Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, let us learn about circumcision indications. There are many religious indications for circumcision. Apart from that, the best indication is phimosis. What is circumcision? It is removal of preputeal skin. So what is the contraindication of circumcision? That is presence of hypospadias is the contraindication for circumcision. Presence of hypospadias is the contraindication for circumcision. Position of the patient is put in supine position, and in children, for circumcision, if it's in children, you give a general anesthesia. If it's in adult, you can give local anesthesia. First, you'll have to prepare the part with, you'll have to drape the patient and then paint the area with bethadine, iodine, and then procedure. If it's in adults, first, if this is the penis, right? Think that this is the penis. Now this penis is held, mainly the skin at the tip of the penis, this is held with at two places using a forceps. With the help of an artery forceps, you will hold the skin of the penis at two places, and then you will separate the prepuce from the glans. This is the glans penis and this is the prepuce. And now you will introduce the forceps here and you will separate the prepuce from the glans, and then you will slit it up in the mid-dorsal line, okay, beyond the middle of the glans. Okay, then the preputal layer which is there, this is trimmed away, which is parallel to the corona, trimmed away in the line parallel to the corona. And then now on the vertical surface, frenular artery which is there, that should be ligated. And then the other two layers of the prepuce, they are united. See, here you are removing it. The two layers of prepuce, they are united by an interrupted catgut sutures. Okay, this is what we do in adults. In children, if you see, in children you will apply, if this is the prepuce, first you will put two artery forceps and then you will apply a gentle traction. Once the gentle traction is applied, you will put a clamp distal to the glans. After putting a clamp distal to the clamp, after putting a clamp distal to the glans, this is the glans, you will put a clamp distal to the glans and then you will excise it here. You will remove the skin distal to the clamp. Once the clamp is removed, the bleeding points are identified and ligated. So this is how you do in children. Then you will suture the two parts of the prepuce. Now, closure. The two layers of prepuce are closed by catgut or vicryl. What are the post-operative complications? Post-operative complications are, there can be injury to glans penis. There can be injury to glans penis, or there can be hematoma formation because of injury to the blood vessels, or sometimes there can be tension in the suture line which leads to painful erection. So this is about circumcision. Thank you guys for watching my lecture.
thank you and thank you for watching.